And joining us now, Dr. Robert Murphy. He is professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Hey, good morning.
Well, let's start with the very latest on the vaccines. How close is the FDA to approving the one by Pfizer?
Well, it's a big week this week because on the 10th, Thursday, the FDA will meet to review all the data for the emergency use authorization, which we call the EUA. They will meet all day to discuss it and review all the data that Pfizer has gathered about their vaccine. That will be made public. Everyone can then see it. They may make a decision as early as that day. Whenever they make it, Pfizer is ready to ship. As we heard before, their central shipping in the United States is based just across the Wisconsin border in Kenosha County. That's good for us.
We've heard about saliva testing now moving into some school districts. In Glen Ellen, they're testing kids. In District 41, I thought it was interesting. They tested all these people. Out of 1,800 saliva tests, only 6 positive results. Is that an argument for opening up the schools?
Well, that's good. That's what we want to see. So you have to start with a base. You have to start with a baseline. And this is really good, and you want to keep it that way. And so they got to figure out, how often they really have to do the testing to keep it down to that dull roar. That's safe. That would be a safe number. So that's good.
But if that's before anyone has been tested, does that mean that really there's not much danger in the schools, or is that just, that gives you a false sense of security, give people a perspective?
Well, okay, that's a snapshot for that day.
I see.
You got to then every week do this. The recommendation had been to test students twice a week. It's really, that's wild. It's going to be very difficult to do. Schools, that's a lot of money for the schools. Look who's doing it. I mean, University of Illinois Urbana-Champaign is doing it twice a week, and Colby College in Maine is doing it twice a week. I'm sure there are others, but those are the ones that have really been very public about their testing program, testing platforms.
All right, let's get some questions here, starting with this. If you believe you qualify to get the vaccine early on, should you reach out to your family doctor now to see if they can administer the vaccine to you when the time comes?
Well, Dan, this is a really good question, all about the logistics of this whole process. It's going to be very limited at the beginning. There's only going to be 109,000 doses, I think, available in Illinois at the beginning. Now, this is going to, of course, expand exponentially as we get into 2021. But who's going to get those first ones? They've already decided that it's going to be healthcare workers, frontline healthcare workers, then nursing home residents. And why is that? That is because the frontline healthcare workers, the whole situation is imploding at the hospitals. If they lose too many more of the workers, the whole health system is going to collapse. Then nursing homes, as Illinois, the disease is back in the nursing homes. I don't understand why this is happening. Something has really slipped up here. So that's where the deaths are occurring. So that's where the first batch is going. But then it's going to loosen up. And so then this question becomes very relevant for people who have underlying diabetes, people who are over 65. And you're going to get guidance from the Illinois Department of Public Health or the city of Chicago, whatever county you're from. You will get the message. And there will be centers where these things will be, at the beginning anyway, where they'll be delivered. And so there will be people to contact. You can always ask your doctor. They're probably very much on top of this.
Gotcha. Another question, if someone in the hospital receives the vaccination before the other one and they move around without taking precautions, i.e. masks and social distancing, how likely is it that the unvaccinated person will get infected? Well,
okay, number one, the vaccines are not 100%. They're 90, 95%. So it's not 100% protective. But the big thing is that you don't reach that 95% until 3 or 4 weeks after the second dose. So we haven't even given the first dose out. So keep that in mind. And you're not protected. The maximum protection is after the second dose.
Gotcha. Dr. Murphy, thanks for joining us again. If you have a question for the doctor, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow. Have a good day.
Have a good day, too.